Hi everyone, good morning, good afternoon, good evening, wherever you are in any part of the world. How have you been? This is Bridget Ezobiako and welcome to my channel, Bridging Healthcare. In this channel, I attempt to support healthcare professionals and would-be healthcare professionals on what makes us special, on why we should be great at our jobs and how we can be good at our jobs, and little things that you can do that can make you efficient and effective. You know very well that healthcare profession is a very, very lucrative, busy, always needing, people to join the team. And so becoming a healthcare professional is not even something to debate about. It is something you should consider and take seriously if that is what you're willing to do. So, welcome again and thank you for coming back. Today I have something I want to talk to you about, and I'm hoping that it's going to be one of the, steps, one of the important steps you need to take as a healthcare professional towards being good at what you do. I recently completed my trauma-informed practice course from theory to practical, and I must say it was a very, very special time. I really enjoyed doing all my work, talking with the team, learning from professionals, and seeing that every single step of the way, being trauma informed will make, individuals experience better, staff experience, that is you, the professionals experience better, and it also reduces the workload of making errors in diagnosis for healthcare professionals such as doctors, surgeons, and everything. So today I just want to I want to give us a little scenario of how an individual can, an individual who is traumatized from wherever they are coming from, how your role as a healthcare professional, and I'm going to be mentioning every different part of the healthcare profession and the different sectors and the different areas, how they can contribute to avoiding re-traumatization of an individual and making it easy. And from top to bottom, you find out that the support worker, the care worker enjoys better. So take, for instance, this person, we just name the person, X, Y, Z, whatever. And this X, Y, Z when they were young, they were taken to the hospital because they were poorly and they were administered probably a medication. And when they were administered the injection, they did not stay calm. You know how young people don't stay calm, to take injection. And the nurse was not patient enough and said, come on, hold. And mom also held down, just so that other people can be attended to. And the person had an injury from it. And since then, for the longest time, they have that pain where that injection was given, maybe because of an abscess or something, and it wasn't really addressed properly. So that person is scarred from that incident, right? So anything, hospital, nurses, I'm just trying to give an example, might not be something that is welcoming for this individual. Now, this individual needs to go to the doctors for treatment, and it has taken a lot of effort to even get this person to get to the hospital. Now, the person gets to the hospital to avoid re-traumatization, because I've already told you this person they already have a thing in their mind, and it is due to that trauma that, well, nurses are wicked, they are not patient, they don't care how I feel, they don't think that, okay, why don't you try medication, they just give injection, they already have that in their mind, which it is, the effect of that is what is called trauma, right? Now, so they get to the hospital. So from the parking lot, this person is already an adult, but this effect is still, because it does stay. So this person is already an adult. It gets to the parking lot and the person parks, and as the person parks, maybe janitor was passing through, and the janitor told them, you're not supposed to park there. Why you parked there? That's the doctor's parking position. And the person did not come out nice at all. And the person just said, you get a ticket if you pass it. So that has already started affecting the whole situation, right? So this person is like, why did I come to this hospital today and all that? Then the person tries to repark, get into the hospital, get to the receptionist. Hello, I've come for my appointment. Sit down. That already is a hostile welcome. Yeah, I've been waiting for a while. Is it my turn? I will tell you when it is your turn. Please sit down. I'm very busy. So, re-traumatization has started. The person has not seen the nurse or the doctor. By the time they are getting to the doctor, if that person tries to muscle courage to wait, maybe because they are not really feeling very well, number one, they will not trust the system. Number two, they will not engage properly. You know, they might even downplay how they feel because they are not sure. They don't trust who is there. Now, let's replay it. So this has happened. The person's trauma has happened. The person gets to the parking lot, parks their car, and somebody said, oh, hi, how you doing? Okay, would it be possible for you to maybe move your car a little bit further? Because, you know, here, there's always a tight, you know, and then the person has gently, softly encouraged that person. That person, oh, thank you very much. Oh, wow, you saved me because I could have gotten a ticket. That alone is positive and welcoming. Then the individual gets into the reception and says, hi, my name is this. Oh, okay. Hi, let me quickly check. Oh, welcome. You know what? Can you just sit down for a few minutes? Give it 5-10 minutes. Let me quickly finish this and I'll attend to you. How have you been? And then the receptionist throw in a little, oh, I love your hair. It's beautiful. You have already given that person a soft landing. It doesn't take anything in your role as a healthcare professional, as a janitor, as a receptionist, as the front desk person to do this. Then it's time for the nurses to come to call you. The nurses come and everybody is conscious of being polite and being kind in their role. So the nurses come and say, hello, Mr. X. Hi. Oh, how are you doing? Did I pronounce your name properly? Yes. Okay, thank you. Please, could you follow me, please? These little things. And then the person gets into the ward and the person is treated properly. And the person is explained to, I would like to do this now. I want to check your pulse now. I'll put this here now. It will not hurt it at all. This one will sting a little bit, but I'll be very gentle. And then you can throw in a little joke. Most people say, when I give injection, my hand is very... So, I mean, I've done that when I was in the nursing practice, you know, and then you do that. Then this individual gets all their treatment. And then when they get back home, let's assume that they are now allocated support workers. You as a support worker, when you come in, you want to support with personal care. You explain, this is what I'm doing. This is what I'm doing. This is what I'm doing. The truth is that when you do all this, you are building an individual who is trusting the healthcare system. So it starts from the least to the greatest. It's not just the doctor that must be trauma informed. It's not just the nurse that must be trauma informed. The front desk must be trauma informed. The social worker must be trauma informed. Everybody. Do you know? In fact, the bus driver should be trauma informed. Everybody in every role in the workspace need to have some form of trauma training, because in practice, trauma-informed practice helps you to be a little kinder to people, a little empathetic, compassionate, and considerate. So that is what I really want to discuss today. Trauma affects everybody in different levels. And don't add to the trauma. Tell yourself, in my role, in my job today, I will not re-traumatize anybody. Even if your job is just to be taking calls. Oh, that's the most important one. Your job is to be taking calls. You take call for internet service. You take call for TV service, mobile service. People have dealt with the wrongest set of people in whatever field that you are in, find yourself. So why not just be a little kinder with people? And that's my advice today. And if it's not just for healthcare professionals, it's for everybody. Just put a little kindness out there. Let it be the little dusting on your on whatever you're offering your service user, and they'll be better for it. Thank you so much for coming again. And my name is Bridget Ezobiako, and this is Bridging Healthcare. Please, let's just keep this channel busy. Tell your friends about this channel and let us grow together. Thank you so much. And don't forget, continue to learn. Invest in education. It helps you to be better. Thank you so much for your time, and see you in the next one. Bye.